In the hour and a half that we spend here going through this presentation, 11 people in the United States will die because they did not follow the instructions of their physician. We're here to talk about PatientConnect, which translates great physician instruction into healthy patient action. Shanil and I built this in the past 36 hours. We're going live demo, iPad app. Patient comes in. We get today's patients from the all scripts. We decide that this person's ready for an IVF. We pick their name. We set an anchor date of when we're going to do the harvest. Let's do it on the 10th, the 11th. And email shows up, and it is a checklist of everything that they need to do every single day of the IVF protocol. It's designed to help them make decisions and manage, come on internet, make decisions, follow their meds. All right, good internet. Yay, sweet internet. So what do you do today? It's still not loaded here. We've also built in Validic for weight. Is built into the experience down on drugs, and also gives information and pricing. There is a dashboard which shows people out of compliance, and the doctor sets what the bars are for what out of compliance is. That's the most exciting part. So we got this far, and we're like, it's pretty cool, mobile, instructions, real-time feedback on instructions, but it felt like Health 1.5. We're like, what needs to make it 2.0? And all scripts tried to tell us, like 1 million people use this. So we thought, what if instead of the great protocols your physician came up with, you were able to look at all of the protocols used by all of the Allscripts installs and their performance relative to yours. So you've got an IVF protocol, but you can see how all the other IVF protocols do at the other Allscripts installs, so you gain the benefit of the system, not just your hospital. That is PatientConnect, live demo, taking great physician instruction, turning it into healthy patient action.
Nice. Great.
All right, Shanil! Heavy lifting!
Okay, judges, 3 answer questions.
How do you track the data for whether or not they're in compliance? How do you send the email to the patient, and then how do you know if they're in compliance?
They get a text message, and then every day there's check boxes, and that is reflected back in the Allscripts platform. And the doctor can set, is 80% a red, or is what's red, yellow, and green for them? Because we don't want to tell the doctor what red, yellow, and green is. We make it easy for them to say what red, yellow, and green is.
So how do you set what red, yellow, and green is?
In the same place that I showed you where you can get other protocols, okay. There's settings for all the big categories of basic activities, red content, and take your meds.
Okay. And where does the protocol get saved? Is that in your system?
So currently, our system is like our database is storing the protocols.
Okay. So that's where we would author the protocol, pick the protocol, okay. And then our APIs. What APIs of ours are you using?
So for Allscript, we had a slide we turned in which had like them listed out, but so get schedule, search patients, get patients full, save notes. So one of the things we set up an endpoint so that it will upload to the patient record any like checkpoints that weren't achieved, as well as the validity getting the weight or any currently we implement the weight, but any other fitness marks.
And you guys started from scratch essentially as well?
For the iPad app, from zero, we had the CSS for the mobile experience from some other project, and a bunch of backend utility stuff like send SMS. We have from other stuff, but iPad app from zero integration.
All the API.
From zero to really whatever feature.
You guys using Twilio for sending text messages?
Twilio for sending text messages. We also integrated GoodRx for drug pricing, Validic for weight wait if that was one of the requirements. Healthfinder.gov, one of the options of things you could send instead of a protocol was for the age and gender, what the preventive health priorities ought to be for someone, and we also integrated into the CDC's vaccine program for, if you're a certain age, it'll send you, this month is the time for your DTaP, or this month's time for your MMR. If I'd have just demoed it, it would have said, you're too old to get a vaccine, but if it was a younger person, it would, every month, according to current schedule, say, hey, it's time to call your doctor and get your MMR.
So that's independent of any action from the docs.
No, that's that was in that choice of protocols. One of them was preventive health. One of them was vaccine schedule. And so you initiate vaccine schedule, and then every month it sends to the patient, and they can turn it off anytime they want, and the doctor can turn it off.
All right, that's 3 minutes. Thanks.
Woo!